Hello, this is Dr. Gay from First Look MRI, and this is a video to illustrate what the hip labrum looks like on MRI. A lot of people do MRIs of their hip to look for a labral tear, and the question is, what is a labral tear in the first place, and what does it look like? So here we go. This is a view looking straight at the hip joint, and we see this bone here, the ilium. Along the bottom part of the ilium, it has a broad, flat area. This is the acetabular roof, and the acetabulum also wraps down here. So the acetabulum makes a cup. This is the socket for the hip joint, and the femoral head is here rounded. This is the neck, greater trochanter over here. And so this is the hip joint. Now around the rim of the acetabulum, we see a little dark triangle. This is variable. Some people it's very small, other people it's bigger. But right here is the hip labrum. It's a little fibrocartilaginous band that goes around the rim. It provides hip stability. Instead of having it flat, it rounds out the circle and keeps the femoral head inside here. And when it tears, it can be painful and cause instability. So this labrum, this little piece of tissue here, is what we're looking for. And it really is hard to see sometimes. And tears can be difficult because there's lots of anatomic variance as well. So in this patient, there's a tiny blip right there, that little white dot, barely discernible. That may be a tiny superficial tear. And also if we go backwards here, this is called the superior labrum along the top. There's another little blip right here that, again, may be a very tiny superficial tear, but the remainder of the labrum looks nice and normal. This is what we would like to see, just a nice perfect triangle with no fluid little gaps. And we're going to look at one more view here. This is called a coronal view, looking straight at the hip. We also take this data and reconstruct it in multiple planes, like this plane here called the axial plane. They have a little anatomic variant here that I did a video on recently. Now this is called the sagittal view. This is the other most important view to look at the hip labrum. So this is looking in profile, the front of their hip, back of the hip. We see that normal developmental thing here, a sublabral recess. And we're going to look at the anterior labrum here. Looks normal. And we're going to go up, around. Now we're getting into the superior labrum. There's that tiny superficial tear, barely discernible. And then another small superficial tear right here. This is one of the smallest tears I've seen, and it can be difficult because of the anatomic variability. There's often little clefts or little recesses that can simulate the appearance of a superficial tear like this. So as a radiologist, we will mention there's a little divot here, could be a superficial tear, and the surgeon will have to make up their mind if they want to go in there and take a look. Thank you very much.